happy, be healthy, be your best. Be your best.
So, what's the buzz all about frequency medicine, frequency treatments, frequency in any way, shape, or form in the alternative health field? It's a really interesting question. And I personally have been involved with frequency medicine since 1993. And over the years, I've found it to be very effective with people. And I guess one of the things that I've really admire about using frequencies with people is that everybody is so different and their bodies are so different that this form of application of trying to work with people really comes up with some amazing results over time. One of the things that I really think about is the fact that you have ones like Einstein, you have Tesla. Personally, I would have liked to have gotten Einstein, Tesla, and Da Vinci all in a room for lunch. You want to see some conversation go about frequencies in that room? And a lot of that science is actually used in other fields and isn't put into question. But in using frequencies to help people with their health, that has really come over a lot of attack over the years, starting back in the 1800s. And even to this day, there's different states that have laws that try to prohibit things like homeopathy. And then there's other states that allow complete freedom of using it. So let's think about why frequencies working with people could be an effective way to get some interesting information about the body. I, for one, find that there are times when standard medical practices, standard medical scanning, medical diagnosis, absolutely necessary, very beneficial. I've just found that, like Einstein said, when you have physical and you combine it with energy, sometimes the results of putting the two together can really be highly effective. And I've seen results with that over the years. One of the things that always impressed me before I got involved was different experiences that I heard from my original mentor about how animals respond to things like frequencies. You don't have a placebo effect with an animal. An animal either responds to treatment or doesn't respond to treatment. And he had some cases where he actually worked with some very, very expensive stallions, racehorses. And they were having some problems with one particular one. And they called him and asked him to just come and just see what he thought, because they had tried the different things like the compresses and the different physical things that they could do, changing the feed, doing everything with this horse, and it just wasn't responding. He was able to pinpoint that the horse was actually having basically some horse depression. And he worked with the horse and just had them start using some Bach remedies on the horse to work with the horse. And within a couple weeks, the horse's symptoms all disappeared and the horse was doing just fine. That animal couldn't respond to something with a placebo effect. It was either going to work or it wasn't going to work. And in this case, it works really well. I've been privileged over the years to work with dogs, cats. I even got to work with a chicken once and was able to see the direct effects of using frequencies with these different animals, whether it was homeopathy, floral remedies, or customized remedies for them. So what can we think of as a modern equivalent that might help somebody that just doesn't quite even understand how that principle works? Well, think of it from the standpoint that the body is so much water content and electricity, okay? Body's basically electrical. There's billions of things going on in the brain every millisecond. And the body readily responds to whether or not it's hydrated, what people are eating, what they're going through emotionally. This can have a profound effect on the body. Well, when you're working in frequency medicine, what you do is, in our particular office, is we use a bone conduction headset, and we have the person's brain, hypothalamus, and a software program interact with each other. And the software program has in it different algorithms that are written in a mathematical format that the brain can identify because they're the way that they are presented in the body on a day-to-day person. So literally, the person wearing the headset and working with the software program, their brain is able to pick out different things that it is seeing on a day-to-day basis, whether it's heavy metals, bacteria, viruses, different emotions, food sensitivities, molds, funguses, the list goes on and on. It'll pick out what it sees, but we never consider it diagnostic because sometimes it just picks out the closest thing. Best example that I give to a lot of my clients is sometimes they can have some microscopic parasites, and the brain picks out of the list of parasites because the list is there's only so many thousands in there, and there's tons of parasites. Let's say that they have a microscopic parasite and its closest cousin is a 16-foot long tapeworm. The brain's going to pick out the closest thing to what they have, and which makes it where it's not diagnostic, it's just letting you know that on a frequency level, either there's residual damage from having had a parasite, there could be residual inflammation, there could be a situation developing, could be residual toxins left behind after the parasite died, or it could just be there. It just gives us a lot of really good information about what's going on in the body. And so it doesn't tend to deal so much with symptoms as finding causes. Another way to help somebody understand it is when they go to the hospital and they have something like an EKG, they really don't have any problem questioning why an EKG can measure the electrical profile of what the heart is going through. And looking at that particular profile, the doctors that are looking at the profile can tell whether or not there's an excess of electricity or whether or not there is not enough electricity. And so based on that, they go ahead and they just suggest to the person either different remedies or different medicines or different exercise, change in diet. Any number of things can be based on what has been measured electrically. Okay. Well, frequency medicine, when you're working with somebody who is proficient at it and using something that measures what's going on in the body as far as frequencies goes, kind of works in the same way. It measures where there's too much energy and where there's too little energy. And then we look for the causes of, okay, if there's too little, is there a problem that they're dehydrated? Is it that they need to have more minerals? Do they need to change their diet? Do they have some heavy metals showing up? Have they been exposed to some black mold? Do they have an excess of candida? If there's too much energy, then have they had an accident? Have they recently been through a really stressful situation? Have they been exposed to different things that might have had a toxic effect on the body where the liver and the kidneys and the spleen are having a hard problem with the toxins? So what we go for in working with frequencies is getting a really good understanding of what the causes are behind somebody's symptoms. So we aren't looking, if somebody has a medical license, if they're a doctor, they're welcome to use the different programs that are available in frequency medicine to diagnose. But if somebody is involved in the field and they aren't a doctor, then what they're looking for is just what are the symptoms? How can they just help somebody with working with their day-to-day lifestyle choices and looking to get the frequencies in the body to read where they're closer to what the gold standard for health would be, where they have enough energy, where they're able to function on a day-to-day basis, where they aren't having digestive issues. These are the types of things that we look for in frequency medicine. So it's kind of like Einstein said, we try to take the frequencies of the body that are shown by the software program and combine it with the physical things that could help the body. And then there are times when it's something where we direct them to, you should go see your primary caregiver because what we're seeing with frequency, you might want to get checked out with this test or that test or get an MRI, or you might want to have an EKG, So it's actually the complementary joining of frequency medicine with standard medical practices that really can benefit somebody as far as improving their health. So when somebody says that they're doing frequency medicine or just working with frequencies with the body, try to look at it that it can be a very complementary thing to what is commonly used in Western medicine, and that really what it's trying to do is to get a correct reading on the body of areas that just need support because they're tired, or areas that have got too much energy going on, whether from stress, lifestyle choices that aren't correct, past exposure to different viruses or molds or funguses or bacteria, and trying to bring a balance to those frequencies while helping people to make really healthy lifestyle choices. So this is just kind of a basic 101 to frequency medicine, and we'll have other episodes where we go deeper into it. I hope this gives you just a little bit more of an understanding of why this is a valuable field as far as helping people's health improve.